Residency is hard, as everyone expected, but it's also really rewarding. And I truly feel like this is the time where you're getting to put so much of what you learn into actual practice. And I think that that's just, what we've all been working towards. And I think that is something that I remind myself of often in on the days that it is hard, is just that this is, what this whole long journey that we talked about in the beginning with all the years of school and everything, and, all those tests and everything leading up to, and just thinking of it as an opportunity to be able to now finally really interact with patients, really be making a difference in what you're doing, and really having an impact with your work.
All right, welcome to another episode of the Black Surgeons Podcast. My name is Dr. Wibonele. Today, I have the privilege of having Dr. Lester here today with me. Dr. Lester is a cardiothoracic surgery resident. She is very excited to be here. I'm very excited to have her here today to kind of tell us a little bit about her story, where she's from, why she chose this field, and what she's doing right now. So, Dr. Lester, thank you so much for taking the time and being here today.
Thank you so much for having me. It's an honor to be here and to be able to talk to your listeners a little bit about my own story, and just share with them a little bit more about cardiothoracic surgery.
Perfect. Just to get started, can you summarize a little bit of what kind of training you need to have to become a cardiothoracic surgeon?
So to become a cardiothoracic surgeon, so like all physicians, you graduate high school. You then do 4 years of undergrad, or rather, however long of undergrad it takes to get a bachelor's degree. You then move on to medical school, which is in most cases 4 years, but in some cases a little bit shorter or longer, depending on any other degrees or any other things you want to pursue during your time in medical school. And then cardiothoracic surgery itself, there's a few different paths to getting to it. You could do a general surgery residency after medical school, which is 5 years with or without some research. And then after that, a fellowship in cardiothoracic surgery, which is 2 to 3 years. My path specifically, I'm in something called an integrated cardiothoracic surgery program. So right after medical school, I matched directly into cardiothoracic surgery. And so I'll do 8 years total. And that's because I'll do 6 years of working with patients and learning my surgical skills and working clinically. And then right now, I'm in 1 of 2 years of research time. All of that together is a really long way of saying it's a lot of training, but you're learning all along the way. And I think with something like cardiothoracic surgery, it's not really a field that you can look at, in terms of when you're done with training, and more so of thinking that life is happening all along the way, and whether, this is the type of life that you want to live.
Nice. I like that mindset. And so tell us a little bit about, where you're from and how you grew up.
Yeah. I'm from Southern California. I was born and raised here and went to undergrad in Southern California at USC as well, so right on. Both of my parents are from Ghana, so they both immigrated here, and really my first introduction to medicine was probably my mom. She's a nurse that works in postpartum care, and so seeing her was probably my first introduction to the medical world. But yeah, I didn't grow up with a lot of physicians directly in my family, but I knew pretty early on that being in the hospital some capacity was something that I wanted to do. And so after growing up in California, I did my medical training in New York, and now I'm back in California for my residency and fellowship.
And so when you were in high school, do you feel like you knew you wanted to be a doctor, or was it more of like, maybe I'll be in the nursing field or physician side, or what was your mindset back in high school?
Yeah, by high school, I definitely was pretty set on being a physician. I think at that point, I had even had in my head the thought of being a surgeon. And that was mostly, in terms of being a physician, I had the opportunity to do some shadowing in the hospital, actually the one that my mom worked at, as well as a children's hospital close by, and just really be able to participate in some volunteer opportunities, just really being around the hospital setting. And I think that early exposure was kind of key in solidifying my thoughts about wanting to be in the medical field. And I think it was the end of high school, beginning of college was the first time that I had the opportunity to be in any type of operating room. I think it was college actually. But from then on, I was pretty sure that I wanted to do surgery as well.
Nice, nice. And so you go to college. What major did you major in, and what was a factor for choosing a major?
So I chose a major in human biology, and I actually had a minor in something called healthcare studies. I chose those as my major and minor because I was pretty sure I wanted to go into medicine, and I just felt like that was the thing that would set me up best going into medical school. But I do think that it's really important for anyone that's in undergrad now or is considering a career in medicine to not feel limited to only studying, the basic sciences. There's definitely so much value in truly learning and pursuing something that you love and are passionate about. And, being the person that does something a little bit different could be really valuable to your team one day and definitely to your patients. I think the most important thing is just pursuing something that you're excited about, that you'll be committed to, and that you'll be willing to work hard at, because that's most of what it takes to make it past undergrad and med school and everything else. And so, yeah, my majors were pretty straightforward, but don't think it has to be that way.
Yeah. And so, how did you prepare for the MCAT and, maybe during your journey as an undergrad? I know I had a lot of friends who were interested in going to medical school, but there's a lot of times where there are challenges. Sometimes some classes might not work out, or you might fail a class, or your GPA might drop a lot. I know I had an issue where first semester my GPA dropped to like a 2.9, and I had to kind of start doubting myself on if I'm not going to be able to make it to medical school. So what kind of challenges did you face in undergrad, if any? And how did you overcome those? And how did you prepare for your MCAT?
Yeah. My biggest challenge by far was OCHEM. Anyone that knows me probably has pictures of me languishing with my head on a desk somewhere and tears in my eyes. I overcame it eventually, but it definitely wasn't easy. I asked for a lot of help. I was in every, office hour option that there was. I used our, tutoring at our school, and just really reached out to any type of network that I had at the time in terms of our Black Student Union, in terms of friends that were pre-med, and basically just seeing what I could do in terms of, I knew I was working as hard as I could at it, but it was clear that I just needed assistance from someone else. And so I think that it's important to, if you can, remember that this whole journey is probably not something that you can do completely alone. And I do think that it's one thing that makes the journey a bit harder for some of us, is that we don't always have a network of people that have done this before us, that we're close to, that we can just call on to swoop in. But they're usually, I think at this point, someone that knows someone, most likely, and being able to admit when you need help and reach out to others, I think is one of the biggest keys to being able to make it through this whole, really long process. Even if it's not an undergrad, eventually there's going to be a time where you're struggling, and it's going to be more than can just be done on, with your own grit and with, hard work. So preparing for the MCAT, I think in some ways having one of those pretty basic science majors helped with that in terms of human biology, because the classes for my major were pretty much MCAT prerequisites as well. And so that was my main mechanism of studying. I was pretty fortunate in that all of my pre-med classes, not that they taught to the MCAT, but they certainly, even in the electives and things that I was able to take, they covered most of the topics that were on it. And then after that, I just took, dedicated time to study for it. I didn't actually take time off from school, but just meaning that it was a dedicated study plan, and not really just something where I fit in where I could, because I think for me and the way I learn, I really need a plan, a way that I'm going to tackle all of these concepts. I broke it down by the sections and then kind of just powered through.
Nice. And so you are now in the process of applying to medical school. How broadly did you apply, and did you get into the medical school that you wanted to get in, or did you kind of got into where you feel like, oh, this is kind of the best option for now?
Yeah. So I applied pretty broadly. I applied, across the country. I applied to kind of a whole range of schools. At the beginning of application season, was pretty set on going to school in California still. So I thought my, first, second, third, fourth choices were all going to be California schools. And by the end of application season, in terms of interviewing and really getting to be able to see what some of the other schools had to offer, I actually decided that this was a time that I wanted to try and do something a little bit different. And so the schools that were at the top of my list at the end of the application season were actually very different than the ones that were at the top of my list at the beginning. And I actually ended up changing the school that I committed to. So I had initially committed to Northwestern. I forget what the date is that you have to say where you're going and kind of decline the rest of your offers. I do think it would have been a great fit as well, and it would have been an exciting place to be. But I ended up saying yes to NYU later on. And I think in part that was due to just knowing a few more people on the East Coast. I think it is important to have a support system. And I'm glad that I went somewhere where I didn't have necessarily family out there, but I had friends and things that I knew could be supportive during medical school. So that was one of the things that eventually pushed me towards that decision.
How, I guess everybody, I know for me, I had to take loans to go to medical school. I guess, how did you pay for medical school? I know that's one of the biggest things that most people are really concerned about, especially nowadays when they decide to go to medical school. Were you able to get some scholarship money or anything to help pay for school?
Yeah, I did actually have a scholarship at NYU, which I know is not the norm and was honestly pretty transformative, I think, for just this whole trajectory in my career. I think that, as you're saying, the student loan burden is really prohibitive for most people, and it was a huge relief in attending medical school. So it's something that I feel truly blessed for every day. I think everyone deserves to go to medical school and be able to focus on studying rather than, how they're going to be able to pay for it either now or in the future. And so I do feel really fortunate in that way.
Do you feel like that impacted on the decision you made to go to NYU versus other places, or no?
Yeah, definitely.
You're like,
Definitely.
duh.
Yeah, if someone says free versus, not free, nowhere that was not free was on the list. But actually, I did have a scholarship, in all transparency, to Northwestern as well. So that actually wasn't the final deciding factor between the two of the schools for me. But in terms of initially choosing Northwestern, it was a huge factor.
So you're in medical school. How was that? Because I know usually when you start medical school, like the first year for everybody is like, this is a completely different ball game. How was that experience for you? And to what point did you feel like, I want to go to become a, cardiothoracic surgeon?
Yeah. So medical school is pretty overwhelming. I think that it was just a shift in many different ways in terms of academically, being away from, where I had grown up, what I was used to my entire life, and then just really diving into so much material all the time and being surrounded by truly what I felt was the most intelligent people I had ever, been around. And there's a lot of imposter syndrome in that, which I know something that a lot of people feel, but it's definitely overwhelming and intimidating. And I eventually just had to remember that, I was there too. I was there for a reason. Someone felt I should be there, and I should be acting like I should be there as well. Mm-hmm. If I was going to be successful and make it through. And I think that some things that helped kind of alleviate some of the, concern or anxiety I had when I first started medical school is our curriculum actually was pass fail. So getting through a few of our modules and realizing, being able to gauge is, this is really how much time I have to put in, how I have to learn to study, etc., to be able to, meet the standards that people are looking for from me. I think that anytime you transition, that's for me, that's one of the hardest things is just figuring out what the new expectation is. And I think you can't really know until you are in it for a little bit and then you kind of start to adjust. But it was the same things as undergrad, right? Is like reaching out to people, asking for help when you need it. For anyone that thinks that they need like additional accommodations or thinks that they need additional assistance, I just really think it's important to advocate for yourself, and because no one is going to usually offer up of their like own accord, but if you identify that something is necessary for you, then you're able to fight for it, then you might be a little bit more successful. And I think the other thing that was very different for me is that in undergrad, even though for individual classes and things like that, I did reach out to not necessarily peers all the time, but maybe people that were a little bit ahead of me or, the faculty, etc., for help with classes. I didn't really have that many friends in undergrad that were pursuing a pre-med track. So I was always kind of like doing my own thing and surrounded by people that were doing something completely different. And I actually really liked that because it got me out of my head a little bit. I could remember that there was like more to life than just medicine and brain pre-med and all the things that I was stressing about were probably like in my own little bubble. And that transitioned a lot, obviously going to medical school, because now I'm surrounded by everyone who all has the same focus. And so sometimes, other people's anxiety also gets put on you. So I tried to be intentional at times about taking a step back, bringing some context to what we were all doing and remembering that like life also exists outside of just whatever we're dealing with at the moment.
I think that's a really good perspective to have early on, because I feel like especially during like the first and second year, if you don't have that or you don't know who you are, quote unquote, it's really hard because you'll find all this, the usual pre-med kids, which I'm one of them, right? We were stressed about our grades, and some people are very anxious about every little thing, and so you can fall into that. Oh my gosh, like, do I belong here? Or oh my gosh, like, I need to do better, or I need to study more, and you're trying to tailor your goals or your studies based on somebody else instead of being like, okay, let me just run my own race. Like, this is my strengths, these are my weaknesses. Let me focus on me instead of just trying to see what everybody else is doing. I feel like for me, first year, I didn't have that much of that perspective, but later on, I was like, okay, I know I'm a visual learner. Like, I can't be just sitting down and reading the book the whole time, right? And that's not gonna. I need a little bit of videos. I need a little bit of that. So when I learned that, I feel like that is when everything kind of changed for me.
Exactly. Like most people I know don't go to lecture. I was someone that still went to most lectures. I still rewatched them, but I just felt like having a time that I was showing up there and like dedicating kept me from procrastinating and all the things that I knew I had a tendency to do. And I just had to do what worked for me rather than, what everyone else is doing. I didn't answer the second part of your question though, which is when I kind of decided cardiothoracic surgery. So funny enough, in part when I got there, kind of because of the things we were just talking about, I was like, well, I absolutely don't want to do anything super competitive because, I want to exist here. I want to do my best in my classes, but I don't want to have to worry about, being in the top 10 percentile or whatever for things. I was like, I just want to learn in school. And so I was like, I don't want to do orthopedic surgery. I don't want to do plastic surgery. I just took them off the board. And then I knew I wanted to do cardiothoracic, but at that point, I really didn't know about the integrated program. So I thought that I was going to be applying into general surgery and then doing the fellowship later, which every residency is rigorous. But in my mind at that point, I thought that, the things like ortho and plastics where you have to be incredibly intense, in my opinion, from day one, I thought I was taking off the table. That turned out not to be completely true because integrated cardiothoracic is basically the same as all of them. But essentially, I made that decision later on. I chose cardiothoracic because even in college, the heart was something that kind of just made sense to me as a pump. I felt like I could understand for the most part what was going on, and because of that, I wanted to learn and to know more about it. And the more I learned, the more exciting it was to me. I was really interested in transplant because of the kind of combination of things that it brings in. Like there's a social aspect to transplant. There's obviously the medical aspect, but there's even like a political component. There are so many factors I felt like that were present in transplant, and I just thought it was an area of medicine that brought together a lot of things that I excited about. And then in terms of just even a step before that, in terms of just surgery in general, while I liked medicine for the societal impact it could make, I still felt like I needed something that was more immediate. And so with surgery, I felt like there was a problem in front of me, and I could provide a solution, and then I could see the impact of that right away. And so that's a combination of those things is how I ended up in cardiothoracic.
Nice. And so how many programs are there in the country that are integrated?
I believe when I was applying, there was 35 integrated programs, and there was less than 50 spots. I don't want to say the numbers incorrectly, but there was not very many. Every year, there's a few more programs that are added, but each program only has 1, 2, 3 spots, although most have one. And so it's definitely, even now 4 years later, still a residency that I think almost everyone does, or in my opinion should apply dual to, so not just cardiothoracic, but cardiothoracic and general surgery, just because there are so few spots. I think there were around 200 applicants my year for those less than 50 spots, so definitely not a guarantee.
Wow, that's pretty competitive. And so I'm guessing you applied to probably all of them.
I did not. Wow. I didn't apply to all of them. And I think that was because I just knew that there were some places that I didn't necessarily want to live. And I also, even in applying and, creating my rank list, which for people who don't know, when you're applying to residency, you get you do your interviews, you have the programs that you're interested in and that are interested in you, and then you have to put all of those programs in order. And so for someone like me that applied to both general surgery and cardiothoracic surgery, I had to put all of the programs that I applied to in order. And even though I applied to, a good amount of the integrated cardiac programs, I didn't end up doing my rank list in terms of being all cardiothoracic and then all general surgery, because it was more important to me to go to a program that was going to make me a really good surgeon. Most cardiothoracic surgeons in the country at this point have been trained through general surgery. It's still a excellent way to be trained. And so even in my top 5 programs, I had a general surgery program because I thought that taking the path was still a great way to get to what I wanted at the end of the day. So yeah, did not apply to all of them. I don't even remember entirely how many I applied to. It's so far away. I was also the first COVID class that was applying, so that was also its own.
Is that 2020
experience?
Were you 2020? Was that our year?
So I graduated 2021, but I was applying in
So
my application cycle started in 2020.
Yeah, I started during COVID, where we couldn't really. I mean, we went to the hospital and stuff, but then we couldn't hang out outside the hospital, which was such a weird time.
Yeah, I think So your match day was peak COVID, but then our whole application cycle was the first virtual everything.
So you didn't even get to do away rotations, anything like that? Wow.
No.
That's a rough time.
Yeah.
And so, you get into residency, you get into the integrated cardiothoracic surgery residency, which is amazing. Congrats. How has that experience been so far? I know residency is a grind. We all know that, but how has that been for you? What you've been learning?
Yeah. So residency is hard, as everyone expected, but it's also really rewarding. And I truly feel like this is the time where you're getting to put so much of what you learn into actual practice. And I think that that's just what we've all been working towards. And I think that is something that I remind myself of often and on the days that it is hard, is just that this is, what this whole long journey that we talked about in the beginning, with all the years of school and everything, and, all those tests and everything leading up to, and just thinking of it as an opportunity to be able to now finally really interact with patients, really be making a difference in what you're doing, and really having an impact with your work. So it's great. We, as in our program, even as interns, we are getting into the OR. I got to do my, first sternotomies and really be able to hold the saw and stand on the surgeon's side of the table, and feel like I was doing something.
It's amazing.
I still have so much more to learn, but it's been exciting so far. And now I'm on a 2-year break for research. So I'm not actively in the hospital and in the operating room, but I will come back. And then really the first part of my training was a little bit more general. So I still had some general surgery time, but when I come back from research, it will all be heart and lung focused.
What's been the most challenging thing about residency for you?
Just that every day you're learning something new, which means that every day you're going to be bad at something. And I think just constantly having to reorient, and not necessarily, as soon as you start to feel comfortable, you are in a new situation and you're pushed a little bit further. I think that's the most difficult thing, like technically or clinically. And then I think mentally it's the same thing that it has been the whole time, is just, seeing in the process, and that you're meant to be there, that you have what it takes to, make it through this process, and that you are going to be on the other side a well-trained surgeon that can really impact patients. I think that it's something that at least I personally struggle with, in terms of thinking that I'm going to make it all the way through and be successful. But so far, so good. And I just have to keep having confidence in that.
Yeah. Yeah. I think we all go through that, right? It's like, especially in surgery, I feel like, sometimes you're in the rotation and you feel like, wow, I'm finally really good at this. And all of a sudden something happens and you're like, I guess back to square one. I guess maybe I'm not really good at this. And I don't think that ever stops, especially if you're going to make a living, as a surgeon. It's like, it's a constant learning opportunity, because every patient is different. The anatomy, even though we think the anatomy is the same, but how many times do you open somebody and you're like, we didn't expect that to be there, especially on the head and neck area. It's like so many things. And we're always like, well, that's a variation. We didn't realize that would happen. So I think all of us would go through that. But as you said, that's so important to just like, remind yourself why you first of all went through all this. For me, sometimes I would pull my match video that day when I was so happy, and I'd be like, okay, so this is what I wanted. So don't forget about that, no matter how hard it is, sometimes you got to remember this is what you wanted. And so and the impact that you get to make on people, right?
Exactly. And also just reminding myself of the times that I didn't think I was going to make it to the point that I'm at now, and here I am. So if I'm having that thought again about the future, like letting the past and history kind of inform what comes next.
Nice. If there was any pre-med medical student out there who's interested in cardiothoracic surgery, what kind of advice would you have for them if they're trying to take on this journey?
Yeah. I think the best thing that you can do, pre-med is a little bit difficult. And I think at that point, it's mostly just, getting as much exposure as you can to medicine in general. And a lot of the things that I did as a pre-med weren't, cardiothoracic related. If anything, there was maybe a little bit of cardiology involved, blood pressure screenings, things like that. But it's more just about becoming confident that a career in medicine is what you want. Because I think it's also okay to change your mind down the line of what part of medicine you want to be in and what really speaks to you. But the first thing is just really confirming that you want to be in medicine. Once you are in med school, though, I think the most important thing is really just exposure. So I know that not everyone has, a big cardiothoracic department maybe tied to their med school or to the hospital that they rotate at. I would spend as much time as you can just with, in the OR in general, in terms of finding maybe a surgical mentor. If your hospital has residents that rotate at it, maybe letting one of the residents know that you're interested and seeing if there's a way that they can help, coordinate you having some more OR time. And then reaching out to potentially people that are outside of your hospital, and seeing if there's any connection or anyone that would let you shadow or do a rotation with them, even if it's not at your own school. If you have cardiothoracic surgery at your own school, then just really getting to know the department, making sure they know who you are and making sure that they know you want to be involved, because they're, at least in all the places I've trained so far, people have been really excited and really open to having med students come and learn. And, worst case scenario, you decide it's not for you, but you get to see a beating heart, which is a really cool experience. So try it anyway.
Yeah. I really didn't have much of a cardiothoracic experience, which I really wish I did, to be honest. Just like ENT, actually, like my school doesn't have an ENT program. So it's something that you just gotta seek out, or maybe you can accidentally get exposed to, and you're like, oh, I love doing this,
Yeah.
You bring a good point. It's like there's so much in medicine, and I feel like any person, any individual, whatever personality that you may be, there's something here for you. And so
Definitely.
I think it's important to keep that mind open as you're going through rotations and seeing what really interests you. And you might even be able to kind of pull in other interests that you have and try to combine those with what's there. So I think that's super important.
I actually think that's one of the most important things in cardiothoracic, and probably similarly for you in ENT as well, is that you definitely can't go through med school or your rotations singularly focused on cardiothoracic surgery and not paying attention to the other to your other rotations. One, because they are important for what you're going to be doing long term. We already talked about it being competitive, so no one is just looking to see how well you tie knots. They want to see how well you worked on a team, even if that team doesn't end up being what you wanted to do eventually. What did you do with your time there? How were you invested, and how did you prioritize your patients? Because that's what you're going to be doing for the rest of your career.
That's a good point. With the changes now, with like the MCAT, I don't know if you have had a chance to maybe sit at or interview or interview a residency here. I'm just curious on, as far as cardiothoracic surgery goes, or general surgery overall, if somebody's interested on going to the field, because the USMLE scores used to be super important, right? On kind of filtering people through. What kind of things can people do now in your field to kind of distinguish themselves a little bit more, other than the scores that they have, like the USMLE, since it's pass-fail?
Yeah. So instead of step one now, inevitably, I think it's now step two. So step two, we didn't really eliminate the requirement from scores. We just kind of pushed it down a little bit further. So that's one aspect. And then outside of those scores, though, because scores, while important, are just one component, I think is research experience in our field is becoming a bigger and bigger aspect of the application. I think in part because it's something that medical students can have access to. So, once you're considering cardiothoracic surgery, again, it's going to be, unfortunately, easier for people that are in a medical school that has a cardiothoracic department. But seeing if you can partner with any of the surgeons there on any research projects, offering to write up things like case reports for any interesting cases that you might see or that they may have been a part of, is one way that you can really demonstrate your interest and get to learn a lot about the field, even if you're not able to be in the operating room all that frequently. Other things is just showcasing, what you're most passionate about, whether that's advocacy, whether it's some other clinical aspect of what's important to you in the future. When I was going into this, I had an interest in global health. They still do. It's kind of difficult to combine with cardiothoracic surgery, but I still think it is something that I was passionate about, and being able to show your passion and what you've already done to realize some of, the goals that you have for the future is a great step. I think it's always better to show people something than to try and tell them. So as much as you can show the type of doctor and the type of surgeon that you want to be in the future, the better off that you're going to be.
That's a very good advice. Show instead of just telling. It's like being actionable. I like that. Lastly, I wanted to finish with, where is Dr. Lester going next? So you have your research for the next 2 years, and then you're going to finish up your training. But what are you thinking right now as far as the type of practice? I'm not sure if, can you be a private practice cardiothoracic surgeon? I believe so.
Yeah.
So what's next for you? What options do you have, and what kind of practice do you want to have?
Yeah. Well, the question of what options do I have is way easier than what I actually want to do. I think that will kind of be decided once I go back to fellowship, because that is really when I'll have more hands-on, like dedicated time really in cardiac and thoracic. I do know I want to do cardiac. So from this path, you can be both a heart and a lung surgeon. However, in most places in the country and most, at least like larger or academic centers, you're going to be either doing cardiac focusing on the heart or thoracic focusing on the lungs rather than both together. So while you're trained in both, you'll eventually choose one or the other in most cases for your career path. And for me, I'm planning to choose cardiac. In terms of the different places that you can practice in a more community, like private-based setting, or in an academic center, or in some cases, more rare, like kind of a mixture of the two of those. But it's mostly, community or academic is the big breakdown. And right now, I think in part because most of us are exposed mostly to academic. Academic is, the first spot. I am in research right now, so I'm very heavily academic exposed at the moment. So that's what I'm thinking for now, but I reserve the right to change my mind in the future.
Yeah.
And then in terms of specialties, I know that you, for instance, are doing a fellowship after you're done with ENT. For cardiothoracic, the only formal fellowship at the moment that you match into do as an HGME fellowship is congenital, which is, in babies and kids. Other subspecialties of cardiothoracic surgery, you may get additional training in and kind of seek out different programs for that. But congenital is really the only formalized fellowship at this point.
How long is the congenital one?
So it officially is 2 years now.
Okay, nice.
There were some programs that did 1 and some that did 2, but I think now everyone does 2.
Okay. That's some challenging anatomy there, I'm sure. They see all kind of stuff.
It is. I ruled out congenital because my brain can't work that way.
It's not.
As I told you before, I liked the heart because it was simple and things flowed mostly in one direction and they all were connected in a predictable way, and congenital throws all of that out the window.
Yeah. I don't know. To be honest, after 5 years of residency and not seeing too much of the heart now, I'm like, do I even know anymore what's going on? Like, if you start asking me about preload and whatever, and cardiac output times heart rate, I'm like, I don't remember any of that stuff. So more power to you guys.
I mean, it's also very important to say that I thought I understood it, and it was much more complicated than I thought it was. But at least I could pretend for a little bit.
Yeah. Well, I appreciate you for making the time. Thank you for chatting with me and kind of highlighting on. Yeah, I learned a lot actually about cardiothoracic surgery. I didn't know about the integrated program that you have to do, the amount of research that you have to do, and you have fellowships that you can do. I thought it was more actually just academia, just because of how much of the capacity of people you need, right? Like the ICUs and all that kind of stuff, and really good information about the field. So I appreciate you.
Of course. And if anyone wants to learn more, I don't know if you include my Instagram or anything like that, but that's probably the best way to reach out to me. It may take me a minute to reply, but I will eventually, and happy to answer any questions that come up for anyone.
Thank you so much. Yeah, for sure. I'll include your Instagram on the podcast. And if anyone wants to reach out, Dr. Lester is here to help. Again, thank you so much.
Thanks for having me.
Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast. Bye.